Right now, the world is in the middle of a health crisis. Many hospitals and healthcare workers are being inundated with patients. Here in the United States, giant hospital ships have been sent in to provide some relief to medical facilities in New York and Los Angeles. But what if a landlocked region needs help? Look, I'm not a medical expert, but there is something from our past that some nations are currently embracing that could provide a solution. I'm talking about hospital trains. They've been used for more than 150 years. Originally, they served as a relatively fast way to evacuate wounded soldiers. But things really progressed in World War I. Trains were still moving the wounded, but many also had medical professionals and facilities on board to provide treatment. Hospital trains continued to evolve during World War II. You can see just how extensive some of these trains were in this New York Central ad. The practice of using American military hospital trains ended after the Korean War. Our armed forces ultimately decided that air transport was the best way to move the sick and wounded to more extensive treatment facilities. These days, trains could play two roles, not just transporting sick people to places where they can be treated, but also as mobile infrastructure to supplement the healthcare facilities that cities and towns already have in place. Fortunately, some of these ideas are already being implemented in countries around the world. According to a report by the BBC, India is currently converting 5,000 train coaches into quarantine or isolation wards. This amounts to around 40,000 beds. France is also using its rail system during the pandemic. According to France 24, the country recently converted one of its high-speed TGV passenger trains into a mobile facility that can transport patients from areas hardest hit by COVID-19 to areas with less cases that have more space for treatment. Some countries were already operating hospital trains before the pandemic. Both Russia and India use them to serve rural and isolated communities. China operates a rolling eye hospital. So could America have something like this? I'm talking about more than just a vehicle that can transport large numbers of patients. This would be a self-sufficient rolling medical center that could travel to wherever it was needed. I think it is possible, but it would be a challenge. The first thing that comes to mind is funding. Would this be a government or military operation, or something a nonprofit like the Red Cross would run? Also, most of the rail in the US is operated by private companies, but the military and other organizations already ship some of their equipment by train, so getting access to the right-of-way is possible. As for rolling stock, the hospital trains of the past were mostly converted passenger cars. However, what about freight cars? Look at this Norfolk Southern camp train. It houses maintenance of way workers while they're on a job. These are basically just prefabricated buildings sitting on top of flat cars. Imagine something that could go almost anywhere in the country. Something that could help during emergencies, or just assist the communities that don't have the facilities they need. Let's face it, necessity is the mother of invention. If times get really tough, I think we can find a way to make this work. And we really should try. If not during this crisis, let's at least be prepared for the future.